Hello, I'm Christina Makowiecka and I head up the Technical Resource Centre for the Ideas team here at the London School of Hygiene and Tropical Medicine. We've got one paper this month. It's called The Impact and Cost of Scaling Up Midwifery and Obstetrics in 58 Low and Middle Income Countries. It's written by Linda Bartlett of Johns Hopkins University. So the main question they're asking is, what would be the effect of scaling up midwifery and obstetric services? And they also look at family planning. That's a third important component. The impact is measured by lives saved. So that's maternal, fetal and newborn lives saved. The cost is measured using an ingredients approach. Scaling up means to 60%. That's what they call that a modest scale up, or 99%. So that would be universal coverage. And the 58 low and middle income countries, where does that come from? Well, it comes from a report that I'd like to draw your attention to called The State of the World's Midwifery. It was published in 2011 and you have a link for this report. It's a really nice webpage by the UN agencies. And here they identified 58 countries that contribute 91% to the total number of maternal deaths globally. So that's where the 58 comes from. Okay, so back to the paper. It's looking at, midwifery. Midwifery is a qualified midwife who can practice active management of the third stage of labour, plus the 7 signal functions of BMOC. Obstetrics is, of course, all of that, plus the 2 additional signal functions related to surgery, so that's C-section and blood transfusion. They're using the Lives Saved tool, again, developed at Johns Hopkins. It's a piece of software that looks at the impact of introducing certain interventions in maternal, newborn and child health on survival. So what do they find? They find that if you have a comprehensive system of midwifery and obstetrics and family planning, then of course you'll save most lives. They also say that if you introduce midwifery and family planning at a modest level, so that's 60% coverage, you can also save 34% of lives. The cost of that package, which is midwifery and family planning, is about $2,200 per life saved. If you introduce midwifery and obstetrics and family planning, the cost per life saved is about $4,200. What's interesting in this paper, we thought for you, is that among the 58 countries that they're looking at, Nigeria, Ethiopia and India are included. So I hope you enjoyed the paper. And if you have any papers that you'd like us to look at, then please get in touch. The paper can be downloaded free of charge from the link that we've given you. Thanks.